My name is Jennifer, and I had a reverse total shoulder on the left side with Dr. Jacobsen in November. I'd always been very active, gymnastics and sports and bodybuilding and swimming, everything you could think of. Years ago in 2015, I had an injury to the shoulder that became progressively much worse. I had a lot of shoulder pain. It got to the point where it was unbearable. And so I decided to go to my primary doctor. He suggested Dr. Jacobsen.
Typically, patients come in to see me because they're having pain in the shoulder, and pain relief is excellent with shoulder replacement surgery. It's also a long-term pain relief. So when Jennifer came to see me for her shoulder, she had been struggling with shoulder pain for a long period of time, well over a decade. She was pretty much bone-on-bone arthritis in her shoulder. One of the things that we found too, as we worked up a little further, was that she also had some tearing of her rotator cuff, which is why I recommended that we use the implant that we did in her situation.
I felt like I was young for this surgery, but I also had to have it done. Dr. Jacobsen did a really great job of explaining everything to me, all the advances in the surgery and the implants that are used today. And my husband was with me, and we were both very satisfied and were quite happy to go ahead with that. I was the first patient for surgery in the morning. They took me right in, and I don't remember a whole lot after that. The next thing I remember, I was in a room. I was in zero pain, and we went home later that day, which was great.
After a shoulder replacement, there are different phases to the recovery of it. In the beginning, we're in a very protective phase. We have patients in a sling, typically for 2 to 4 weeks after the surgery. They start physical therapy right away. Physical therapy is critical for getting a good outcome. The surgery is half of the recovery. The physical therapy is the other half of it. Usually at that 3-month mark is when I'm telling patients that they can pretty much do whatever they want, but there's still recovery that will occur even up to 6 to 12 months out from surgery.
Physical therapy started, I think it was just a few days after the surgery. I also did my exercises at home throughout the day, and I think that's really important for people to do. I was way ahead of the timeline of what I should be able to do, and I don't have a good explanation for that other than I followed his directions and did what I was supposed to do. I was fully functional way before 12 weeks, which was a huge surprise.
She has made consistent improvements in her pain levels and her functional ability. She did an excellent job with her rehab and got back to a level where she was satisfied with the function of the shoulder.
So I would say the one thing that really stood out to me was how easy and just amazing it was. I'm so sorry I waited so long, and I would truly urge anyone having shoulder issues to go see an orthopedist, a specialist that does shoulders. Dr. Jacobsen is a great choice, and have yourself evaluated.
Shoulder replacement surgery is really in somewhat of a renaissance or a golden age right now. We have seen a lot of high-tech improvements in not only the way we plan for the surgery, but also in the way we carry out the surgery. We get a lot of good to excellent outcomes with patients, and the most common thing I hear from my patients is not, "Oh, I wish I didn't do it." It is, "I wish I had done it sooner."
I am so very happy that I made this decision and had this done. For people that are a little wary of having a shoulder replacement like I was, things have changed so much. It is worth it for you to go to your doctor, follow their directions, take care of yourself, and just go do it. It's life-changing.